Welcome to the Dr. Lori Mars podcast, where she interviews experts in health and science, sharing their expertise so you can live your healthiest life. This episode of the podcast is proudly sponsored by Fit Vegan Coaching, the world's leading whole food, plant-based body recomposition program for Gen X and baby boomers. Founded by Maxime, whose personal journey began after losing his ex-fiancée to breast cancer, Fit Vegan Coaching is on a mission to disease-proof the world through the transformative power of plant-based eating and fitness. This program is the Rolls-Royce of plant-based coaching, offering all-inclusive services, personalized plans, world-class accountability, lifelong support, and more. Say goodbye to the yo-yo dieting and embrace a lasting transformation that will rev up your metabolism even post-transformation. Ready to take charge of your health and vitality? Head over to fitvegan.ca, that's fitvegan.ca, and mention Dr. Lori for exclusive bonus savings when you sign up. Don't miss this opportunity to join the movement towards a healthier, fitter, and more vibrant you. Are you tired of compromising between convenience and healthy eating? Look no further. Introducing Whole Harvest, your ultimate solution for wholesome plant-based meals. Whole Harvest is redefining the way you eat. Their meals are not only delicious, but also 100% whole food plant-based without any compromise. Whole Harvest takes pride in their approach. There's no oils, no added sugars, and low sodium. Plus, they have SOS-free menu items available. I recommend Whole Harvest to my patients. They need convenient and compliant meals that can be delivered to their home. At Whole Harvest, you can reimagine your favorite dishes with a plant-based flair and enjoy menu items like the All-American Burger, Harvest Lasagna, and Soba Kimchi Bowl. Whole Harvest meals are chef-crafted and made with high-quality ingredients, delivered straight to your door. And guess what? They ship nationwide, so you can enjoy whole food, plant-based meals no matter where you are. And here's an exclusive offer just for our podcast listeners. Use the discount code PLANTS30 to receive $30 off your first order. Visit wholeharvest.com and place your order today. Again, that's wholeharvest.com. Your journey to delicious whole food plant-based eating starts here. This episode of the podcast is proudly sponsored by The Healing Kitchen, your path to vibrant health. Immerse yourself in the transformative program, guided by the combined expertise of myself, Dr. Lori Marbus, and Chef Brittany Giroudi, who has lost 70 pounds on a whole food plant-based diet. Here's what's in store for you. Virtual weekly sessions. Engage in an immersive 60-minute virtual session every single week, where you'll delve into the world of wholesome plant-based goodness right from your own kitchen. Cooking with Brittany the first half hour. Unleash your inner chef as you're captivated by Chef Brittany Giroudi's culinary mastery that will delight your taste buds and nourish your body. Medical Q&A with Dr. Lori the last half hour. Prioritize your well-being during the second half hour. I will personally address your medical inquiries, providing evidence-based insights and personalized advice, empowering you to make informed choices for your health. So join us on the Healing Kitchen to help you step into a healthier and most vibrant future. Welcome to the podcast. I'm Dr. Lori Marbus, and today we have a special guest who's a nephrologist who specializes and understands plant-based nutrition, which I'm really excited to get to, but we'll hear his story. Is Shivam Joshi. How are you, sir?
Good. Thank you for having me, Dr. Marbus.
Yeah, absolutely. Call me Lori, please. I should have said Dr. Joshi. Nephrologist extraordinaire, and you've been all over, it sounds like. So could you tell us a little bit about your background and why you chose to become a nephrologist?
Yeah, so I love the kidneys. That started at an early age, and my passion initially was in kidney transplant, and I thought I was going to be a transplant surgeon. And props to those who continue the pathway and actually are surgeons and doing that work, but it's incredibly hard. And I got deterred by the long hours, and the brutal schedule work. There's not much work-life balance. And so I wanted to become a transplant nephrologist, which is the non-surgical side. But then in my fellowship, I realized that actually what we need more of are preventative nephrologists, which wasn't really a thing that existed. And I don't want to take credit for starting it because I know other people have been doing it, but I that was my goal, was to help create a field called preventative nephrology, where you emphasize not only just treating kidney disease after it's happened, but also helping prevent it, preventing its progression, preventing it from occurring in people, and then just educating others about what it is and how to prevent the most common causes of it.
Mm. So you you mentioned that you became interested in the kidney at an early age. Where, what, how, and why?
I would say that, I mean, early in terms of my career. So in medical school, I got like maybe like the first month or two there, I got really into kidneys. I don't know why. I think it's just many nephrologists, kidney doctors like myself, have a gravitation towards numbers. So I think that probably
Mm,
explained it.
mm. You probably
Um,
could be an
you
engineer
know,
as
there's
well, some of those guys.
Yeah, so some people know they want to do stuff with their hands. Some people don't want to talk to people, or they might be a radiologist, or not to diss anyone, but there are certain traits within the specialty that exist, and people gravitate towards them. And
Yeah.
uh, I think for nephrology, that is with numbers and things like that. So for me, that's how it started. And as I went through my training, what I realized is that in parallel with what I was learning was that for my own health, that eating healthier lifestyle was really important, and I got very little of that education in medical school, which is on par with many medical schools, although that's changing with the rise of culinary medicine and people understanding the importance of nutrition. But as I progressed, I realized that there was actually very little information about plant-based nutrition in nephrology. So that's actually in fellowship, I had kind of this, I don't know, awakening, or this kind of change, or this process where I started giving a talk, and then someone talked about it, and because it was so new, I started getting more invitations to talk about it around the country. And with I've even collaborated with Dr. Hashmi, who you've had previously, and other people. And now there's more of us, and we're all trying to push this needle and say we need to emphasize more on diet and nutrition, kind of like how the cardiologists have been doing for decades.
Hmm.
There's still a lot of work to be done, but nephrology is behind on that curve, and it's unfortunate because dialysis is so costly. Having a single patient on dialysis can cost $90,000 to $100,000 per year for whoever that insurance company is that's paying for the dialysis for that patient. And you
Wow.
talk about cost, there's also lives lost because dialysis doesn't keep the same longevity as having a normal kidney. And you talk about the impact that has on families and friends and society. So some of that's inquantifiable. But that's why it underscores we really need to prevent kidney
Right.
disease.
Absolutely. So can we talk a little bit about what's the difference between like animal proteins and plant proteins when it comes to kidney health? Because I think there is a lot of discussion and maybe some confusion, I think, in the general public about that.
Yeah. Um, so and part of that confusion actually comes from our society, from our society. As nephrologists, we have kind of emphasized consuming animal protein for a long time because we thought that protein was high in value, high in biological value. And many of our patients are on dialysis. They have a harder time absorbing protein, and they have higher protein requirements. So we would emphasize eating these so-called high quality proteins, like animal protein. But what we've learned is that it's possible to eat plant protein and meet all the nutrition markers when you have kidney disease, and also when you're on dialysis. And what we've learned is not only are you able to meet the protein requirements, but also you're able to attain some other benefits that you wouldn't get with animal protein. For example, plant protein has fiber, which helps with the microbiome. Plant protein can help with blood pressure, can help with metabolic acidosis, can help with high phosphate levels. There's even observational studies showing an association with a reduction in mortality. So there's all these other potential benefits with plant protein that you don't get with animal protein. So now we're kind of shifting the other way, that make sure you get plant protein as well. Try and emphasize 50% or more of your proteins from plant protein. Obviously, not everyone can eat exclusively plant protein, especially when our society is so heavily entrenched in animal protein. But if we can help move patients along the spectrum and meet them where they're at, that's certainly an improvement.
Absolutely perfect. So now, when you have the different stages of kidney disease, can you just kind of give us an idea of like the general public, the population we're dealing with kidney disease, and maybe break down that a little bit? Because some of my questions, I think, is as people are embracing a more plant-based diet, what do they need to be cautious of, and when in that journey?
Yeah, so there's 5 stages to kidney disease. About 16 or 17% of the population has kidney disease. Most of them have early stage kidney disease and don't know it. So if you have not been tested recently, you should go and get tested, and that just involves routine blood work with a primary care doctor. But a lot of people don't see their primary care doctor. They can't get the labs to get tested, or they may get tested but don't follow up to understand the labs. So there's 5 stages. The stage 1 is the most benign, or the earliest stage, and then stage 5 is the most advanced. And stage 5 also ends up can lead to kidney failure, or also is also known as kidney failure when you end up on dialysis or receive a kidney transplant. The biggest causes of kidney failure are diabetes being number 1, and the second biggest cause is high blood pressure, both of which are largely preventable, but unfortunately all too common.
Hmm. So, at what stage, I know people will say, okay, they have blood markers that show elevated creatinine or whatever, low GFR, and they eat a plant-based diet, and these numbers improve. Can you explain what's actually improving? Is it just decreasing inflammation? Because my understanding is that there's more of a scarring, and it's just you're just decreasing inflammation, and that's what you're seeing, that bump up and improvement in numbers. Or am I mistaken?
Yeah, so I've seen that in a variety of studies, and then sometimes it's a little bit hard to explain. Um, for some people, they may have some improvement. Maybe they had some reversible component. Maybe their blood pressure was a little bit higher and it was causing damage, and now they switched to a plant-based diet or a DASH diet, and that helps control their blood pressure. And now their kidney function is improving because there's less damage, and now the kidney is healing. There's also a water component in these plant foods, so maybe people are a little bit more hydrated as opposed to not. Um, People may also need less ACE inhibitors or ARB medications if they're eating a plant-based diet. They may lose weight, the blood pressure improves. I've seen that in a few studies. And then some other people, there could be changes in terms of how much filtration is actually happening based on the level of protein. So the more protein you eat, the more filtration you have. But over the long term, that can be problematic because that can cause a decline in kidney function because you're essentially causing the kidney to work harder than it should. So there could be a component of that playing as well. But plant protein tends to be less burdensome for the kidney compared to animal protein.
And why is that, would you say?
We don't really know that. There's only one study that really did this comparison head on and did it appropriately so that we can make this inference. But it probably comes down to the individual amino acids within the proteins themselves. And for whatever reason, plant protein is less inflammatory, less acidic, um, uh, perhaps gentler for the body compared to animal protein. So we see less hyperfiltration. That's the term that it's called with plant protein compared to animal protein.
Hmm. So, is it do you think it might be the sulfa component found mostly in animal products, or no, with the
It
proteins?
could be when it comes to for blood pressure. People have studied this, and people say that there's certain aspects of the amino acids that contribute that are associated with having a higher blood pressure, but people have not studied this for hyperfiltration.
Oh,
But you could be right. We just
interesting.
don't know.
Okay. And so as someone is thinking, okay, they're listening to this, they're like, I have kidney disease, I have high blood pressure, diabetes, whatever. Um, so up to what stage can they just go all in? And is there, because of the potassium and your concerns there, at what point do they like, I have stage four, whatever. I need to be more mindful and let my nephrologist know what I'm planning on doing.
Yeah. So, and if you have early stages of kidney disease, most likely you don't have to worry about potassium or phosphorus unless you've had these problems before for some reason. Some people can have high potassium levels and not have kidney disease because they're on a medication or something, and then other folks don't have this problem. So uh, there is a little bit of caution and a little bit of grain of salt, but we have been moving in general in a direction of liberating the diet because historically, the old diet, as I was mentioning, we used to say eat a lot of animal protein for the protein aspect. We used to tell people also to avoid eating plant foods because of the potassium aspect. We were very concerned about potassium. We were also concerned about phosphorus, and this old renal diet, as it was called, excluded a lot of these things. It excluded a lot of these healthy foods. Now we're moving in the direction based on evidence that's accumulated, showing that actually these foods are not only healthy, but don't cause problems that we thought they would.
Hmm.
So we've been telling our patients, especially those who have early stage kidney disease, even moderate stage kidney disease, to eat a salad, have a banana. It's okay to eat beans. Put down the processed food, burger, pizza, French fries, potato chips, et cetera, and eat these foods, which are some of the healthiest foods on the planet, not only for the kidney, but also for all the other aspects of the body. And I know you know this, but for diabetes and blood pressure and obesity and cholesterol and kidney stones and on and on and on. So fortunately, uh, the field has been moving in this direction, and other people have also independent of me have also uh, um, seen this evidence and realized it, and together, alone we're one voice, but together we're a chorus, and we've been uh, singing this song now for some time, for a few years at least, and I think things are changing. When should people start being cautious in regards to their plant-based diet? Probably in advanced stages. You would anyone that's stage 3 or more can see a dietitian to get more hands-on guidance. And there are some pitfalls to be mindful of, like juices, for example, can raise potassium levels, which some folks don't know. And working with a dietitian, especially one that is skilled in plant-based diets and kidney disease, can be very useful. And finding one can be hard. So that's why I've created a list on my website, afternoonrounds.com, that has a list. I don't get any kickback or anything from them. I just created that because it's a common question I get. I get questions from folks all across the country. Where can I get more information? And in many states, there are no plant-based nephrologists that I know of, but at least they can access an RD virtually because there's less restrictions um, in terms of RD care. So it's always important to work with an RD, and then also to have labs periodically checked with a nephrologist, because some people, for whatever reason, can have high potassium or high phosphorus, and others may not. But it's always important to be supervised and be cautious. But what we've seen in the literature is that people eating plant foods, vegetarian foods, generally don't have high potassium levels. It's actually the rare bird that we see an instance of that happening in the literature. And when it does, there's usually some sort of confounder or some other variable at play that affected and caused that potassium level.
Mm. So have you any fun patient stories of improvement or maybe even coming off of dialysis?
I Coming off dialysis is pretty hard. Generally, once you're on dialysis, it's pretty hard to get off of because it's every 3 times a week. It's almost every other day for the most part. Um, People sometimes do come off dialysis in the regular nephrology sense. If they have AKI from rhabdo or not, severe diarrhea or something, and then they recover. From the plant-based perspective, a little bit hard. I haven't had a case like that, but what I can tell you is I've had a few people who've done remarkably well for their disease. I've had, um, for example, polycystic kidney disease. I've had patients who eat a plant-based diet and have been able to delay the progression of when they need to go on dialysis by several years, if not maybe a decade. I've
Wow.
had other patients who've come to me with stage 5 kidney disease knocking on the door of dialysis and been able to put it off for months to years by making transformative changes. But I also want to caution, because I've also seen some other folks who've come to me trying to get those results. They come stage 5, and they really need to start dialysis at that point. Sometimes stage 5 can be stage 5, you can wait, and it can be stage 5, no, you need to start dialysis today.
Mm-hmm.
And so I don't want to mislead folks and say that everyone to stage 5 can reverse their stage 5 or put off dialysis for a long period of time just by eating a little bit more green. Um, some people may have benefits. They may have improvement in their diabetes or blood pressure. They may lose weight, and that reduces the damage in their kidney, and they're able to hang on. But other people, that ship might have sailed a while back, and at that and at that time, and now you might just need dialysis in order to survive.
No, I
So
agree. Yeah.
yeah, so I want to it is, when I see positive results, I'm encouraged, but um I don't want to be answering emails next week
Mm-hmm.
telling people to go to the emergency room to get dialysis, which has happened,
Mm.
believe it or not. So um
No, I
yeah.
believe it. No, I mean, it's a balance, right? And it's interesting because patients will reach out and book an appointment with me and see me, and they're like, okay, I'm ready to go plant-based tomorrow. Stop all my meds. I'm like, no. It's like, or they haven't been taking care of their diabetes. Like I had a lady more recently this year who came in, has had uncontrolled diabetes for almost 2 decades. When I put a CGM on her, her blood sugars were topping out at 400 consistently. A1C
Wow.
was 12, 13. And I was like, and she's like, I don't want to be on meds. I'm like, well, you might need to be on medications. Let's have
Right.
this discussion. And we put her on the appropriate meds. We got her down. She had a wound, it healed. And what was amazing was now we stopped insulin after 3 months. She goes, I've never seen blood sugars like this. I'm like, well, that's what's happened when you change your diet. And yeah, so those are really fun stories, just how excited they get. I was like, wow, I didn't know my body could do that. I'm like, well, get out of the way,
Right.
your body will do its thing. um but I would love to hear, we kind of skipped over it. I typically try to get your personal story, but how did you transition into, is it plant-based nutrition or lifestyle in general in your practice? Because you just kind of said I was interested in it, but like, how did all that evolve?
Yeah, I think it started perhaps that started at an early age, predating perhaps med school. So I am Indian by background, and many Indians are vegetarian by religion or culture. So I had that going for me, but but I wasn't always vegetarian. So there was points in my life where I ate the standard American diet, and so that kind of primed me to a plant-based diet, and I was aware of some things like tofu and whatnot. And as I was going through residency, I started which is a stressful time for doctors. It's 80-hour weeks and not much time for sleep, and you're on call and things like that. I started to have health problems of my own. I had my cholesterol was creeping up, my A1C was creeping up, so I started to make changes to return back to being plant-based, and I became vegetarian. But just because you're vegetarian doesn't mean you're eating healthy. You can obviously eat very unhealthy Oreos, French fries, processed food. And it was during this time that I was reading different books. Back at that time, you have to go back 10 years now. Uh, the books at that time were books by Dean Ornish, and then there was a China Study and Food Revolution, and all these books. I started reading these books, and I was learning all this information, and I loved how they included citations and references, because as a physician, you want to know where getting this information. And some of those references I would go look up, and I would be like, oh, okay, this is real information that is being used that was just not included in medical school or at any point in my training. And so I started using that information not only for my personal life, but also for my professional life. Why are we not including this? Why do we not talk about it? Why do we not discuss this in papers? Why do we not present this in conferences? Why is it that we always just focus on the newest, coolest medication, which happens also to be the most expensive, but we don't talk about carrots or kale? And people would say, "Oh, that's we know that," but do we? And I don't know if people fully understand. And there's actually a whole science and literature, and you can actually become board certified in lifestyle medicine. And there's all these things that one may say that they know, but there's actually so much more to it. And then the other thing is I remember asking this question in grand rounds, and the speaker went back to me and said, responded back to me, and I think which was inappropriate at that time, and said that, yeah, you could eat a plant-based diet, but you'd be sitting at a table all alone because everyone else will be eating all the fun food. And yeah, but that's also the mindset that we are dealing with. There's a lot of bias, and we see that. We know that literature exists. People who eat unhealthy, who smoke, who don't exercise, tend to counsel less, tend to believe less in these things, tend to emphasize it less, and unfortunately, that results in less behaviors, healthful behaviors being adopted by patients, and which unfortunately leads to the perpetuation of these chronic lifestyle diseases, which are unfortunately then just continuously treated with medications, which is unfortunate.
It is. I tell people now, it's like if you withhold the information regarding lifestyle interventions, a whole food plant-based diet and such, I consider it malpractice. It'd be like withholding a prescription that could save someone's life. So it makes no sense to me why we wouldn't do this. Some of the other questions I get around kidney stones and certain, oxalate rich foods. Could we just maybe you talk a little bit about the kidney stones, what they should be looking at, and what foods they should be cautious of if someone has a family history or something like that?
Yeah. Kidney stones are most often caused by not drinking enough water, eating too much salt, eating too much animal protein, and not eating enough fruits and vegetables for the most part. People often attribute the development of kidney stones to some food that might have some oxalate in it or something like that. But what the but the main causes are actually many aspects of the standard American diet. And for some people who do have documented problems with oxalate metabolism and have high amounts of oxalate in their urine, they definitely need to watch the foods that they eat, especially some of those foods that contain high oxalate. The foods that contain high oxalates are your spinach, rhubarb, chocolate, beets, star fruit, cashews, almonds. A lot of these things have a lot of oxalate in them. You want to avoid them if you are someone that has true diagnosed oxalate issues. For the vast majority of people that I see that have kidney stones, the issues are, like I said, they're not drinking enough water. Often they tell me that they don't like water, but unfortunately you do need water for life. And then salt. People tell me that they don't eat salt. They don't add salt, but what they don't realize is salt already being added for them. So I encourage them to check nutrition label. And then they don't eat any fruits or vegetables. And then that causes problems too, because fruits and vegetables have a lot of natural stone inhibitors, like citrate, potassium, magnesium, all these compounds that can help prevent stones. And the last thing is animal protein. Animal protein is very acidic, acidifies the urine, and increases the risk of having a kidney stone. So I tell people to make these big four changes. And for many of them, it actually helps them transform their urine. There's a test that you can do, a 24-hour urine collection, and that resolves most of the issues that they have on that test. And then every once in a while, I see somebody that has an oxalate issue, and we have to work on the oxalate. But for the most part, people don't really need to avoid eating spinach. And most people don't eat spinach all the time. But if you're one of those people that's eating spinach 3 times a day and you're combining it with, say, almond milk, and you throw in some, I don't know, beets, then you can start running into problems, and then you really need to back off of those things. So there is a way to overdo the oxalates and get stones, but that's not really the issue for most people.
Yeah, because some people, they pound in a couple of pounds of spinach, 16 ounces or so, into their smoothies, and they gulp it down daily along with almond milk, things like that. So question, when we look at, I was interviewing a plant-based endocrinologist and uric acid. What about uric acid? Is there anything there that related to kidney health and things that we should be aware of?
People used to think that, but there were a recent series of studies that kind of debunked that and showed
Okay.
that there isn't really an association between uric acid and developing kidney disease, and then lowering it doesn't really help with kidney disease. We used to think that, but a few studies as of recently have come out just showing that there's really no association. However, if someone has gout or is symptomatic from the uric acid, or has stones, or has a lot of uric acid crystals in the urine, then it might be worthwhile to have it addressed. But I think we're backing away from just trying to lower it just to help with the kidney.
Gotcha. Yeah, when I was active duty Air Force, I was deployed to the Middle East, and I they didn't have, like, the ER was the clinic, was everything. Everything was there. And I saw so many young men come in with kidney stones. Like, I saw more in that period of time than my entire career as in regular practice. So that dehydration piece is so true. Oh my goodness. Um, so if we have someone who is, let's say, listening to this and they're like, okay, I have kidney disease, I have this, I have that. What are some of the foods that you'd recommend them getting started, and how should they approach this conversation with their nephrologist if they have a nephrologist or their physician?
Yeah, so I would say to again, work with a dietitian. Try to find one that has some familiarity with plant-based diets, and then also to inform their physician that they're changing their diet so that they can get labs checked during this transition. Maybe their labs are being checked maybe a couple times a year, but now with the transition, they need to have labs checked a little bit more frequently. As for foods, I would say to start with foods that one likes. Doesn't make sense to start with foods that you don't like, because then you may not continue it, and then you might go back to all the unhealthy foods that you were eating before. But whatever you like, to start there, as long as it's plant, unprocessed, and you haven't been told otherwise to avoid it. For example, some transplant patients need to avoid grapefruit juice and grapefruit products. So otherwise, other foods are fine.
Cool. No, that sounds fantastic. Well, I know I kept you closing in on our time that we agreed to, so I really appreciate you coming and sharing your knowledge today. This was great.
No problem. I'm glad to be here, and it was my pleasure. Thank you for having me.